Good afternoon. This is Dr. Bhupesh once again from Dr. BKM Institutes, and this is the second role play. The first one I did for the doctors, which even nurses can hear to learn a lot about speaking. And for the doctors and for the nurses, it's kind of similar. Please revise the role play, which is prior to this for the doctors. It will also help the nurses. And now I'm taking you to the role play of today, which is primarily for nurses. So this is the role play of the day. So this 52-year-old patient has returned to Australia after a year away. Whilst overseas, she was involved in that is the role play of yesterday. I'm sorry, I'm just gonna take to another role play. That is something that we did yesterday. So this is not the one. This is for the doctors that we have just done. So this is the role play of today. So reception center at a public hospital. So there is a public hospital and somebody has come to your reception center. You are working at the reception desk of a public hospital. So basically you are a nurse, you are working at the reception desk. The son daughter of an 81-year-old man who has recently been diagnosed as suffering from kidney failure. So this is a very different kind of a role play. Again, this is difficult role play because son is a third person. So you will say your father is having, he is having rather than you are having. So it becomes little trickier when you need to ask questions. So you will ask, how long is it going on? Does he smoke? Does he drink? अगर आपको ऐसे क्वेश्चन पूछने पड़ते हैं तो वो डज बन जाता है, डज ही. तो थोड़ा सा चेंज, जबकि सिंपली डू यू स्मोक पूछना आसान है. तो इसलिए थर्ड पर्सन रोल प्ले की प्रैक्टिस जरूर करनी चाहिए आप सबको. सो हु इज टू अंडरगो ट्राई वीकली डायलिसिस प्रोग्राम. सो उसके फादर को हर 3 वीक्स में डायलिसिस प्रोग्राम करवाना है. So he has approached to ask some questions about his father's condition and the proposed treatment. मैं आपको हमेशा बताता हूँ जब रोल प्ले छोटा होता है कि पेपर में बड़ा आएगा. तो जब पेपर आएगा तो इतना बड़ा रोल प्ले आएगा, आपको सारी इंफॉर्मेशन दी होगी. फाइंड आउट व्हाट द सन डॉटर ऑलरेडी नोज अबाउट डायलिसिस. तो आप बच्चे से पूछ सकते हो, उसके बेटे से, क्योंकि वो 80-year-old का है तो सन भी अराउंड 55 का तो होगा ही. तो आप पूछ सकते हो कि आपको डायलिसिस के बारे में पता है. उसको ये बताना है एक्सप्लेन व्हाट किडनी फेलियर इज. उसको ये भी बताना है किडनी फेलियर क्या होता है. एक्सप्लेन दैट द किडनीज आर नो लॉन्गर वर्किंग. सो उसको दूसरी चीज ये बतानी है कि किडनी आपकी काम, उनके फादर की काम नहीं कर रही है. डायलिसिस के बारे में बताना है कि ये एक मशीन होती है जो क्लीन करती है सिस्टम को, तो आपको ये चाहिए होगा. देन एक्सप्लेन फादर की ट्रीटमेंट इज टू हैपन 3 times a week. तो वीक में 3 times होएगी. उसके बाद वो सन कहेगा नहीं नहीं मुझे नहीं करवाना, या ऐसा कुछ भी कह सकता है. तो आप, या उसका फायदा क्या होगा, तो उसको बताना है दैट वेदर दैट फादर्स मेडिकल कंडीशन इंप्रूव नहीं हो सकती है. इट इज वेरी अनलाइकली दैट द किडनीज विल स्टार्ट वर्किंग अगेन. तो आपको कोई झूठा हौसला नहीं देना, बट एट द सेम टाइम बताना पड़ेगा कि वो इंप्रूव नहीं करेगा. गिव डिटेल्स वेदर द ट्रीटमेंट इज पेनफुल और हैज एनी साइड इफेक्ट्स. तो आपको पूरा रोल प्ले दे रखा है. टेक्टफुली warn what could happen if his father decided not to continue. So आप ये सारा रोल प्ले मैं आपको बोल के दिखाता हूँ एंड यू विल फील, देखो कितना इजी होगा पेपर में. गुड मॉर्निंग, माय नेम इज भूपेश. आई एम अ नर्स हियर at the reception desk. So could you please tell me how may I help you? Oh well, nurse, see, I have been told that my father is having a kidney failure, so he has to undergo dialysis program and I am really confused. Well, don't worry, I will explain you everything. So could you please tell me that what is your that do you understand what exactly dialysis is? Well, nurse, I don't have any idea. I have heard few of my friends undergoing dialysis, but I have never realized what exactly it is. But today it's my father's, he needs dialysis, so I want to know everything about it. Well, don't worry, we will explain you everything. First of all, I would tell you what kidney failure is. Kidney failure is something that where kidney stops functioning. Kidney is a very important organ for excretion. So when we do urination, kidney is the maximum involved organ and it is very important to maintain the electrolytes, to maintain its balance. So kidney is one of the vital organs, and in case of your fathers, they are not working. And this means that your father has to undergo regular dialysis. What is dialysis? Or dialysis is basically, it is a kind of a machine which cleans the blood. So it will clean the blood thoroughly. So your father's blood would be changed every day so that it is free of any of wrong electrolytes, so that all the balance of your blood, of his blood, can be maintained. Well, nurse, but this seems to be a very difficult task. Well, yes, it is a treatment which requires lot of attention, but don't worry, we will take care of your father, as our department is well trained and it is known as renal department, and they are very efficient people and they know everything, so you don't have to worry. And your father has to go undergo this treatment 3 times a week. Well, nurse, 3 times a week, it is too much. Well, at this point of time, I would like to say you that it is very important for your father to undergo this treatment so that he can feel little better. But nurse, do you mean that he would be fine? Well, I am afraid to say, as your father is 81 and his kidneys are not working well, so even after giving the dialysis, your father's condition is very unlikely to improve, and it is also unlikely that the kidneys will start working again. But nurse, then why are you giving treatment? You just say that my father's condition will be better. I mean, better means that basically that he will have symptomatic relief. That means whatever symptoms he has been facing, like edema and other things, will subside and he will be better. But it does not mean that the kidneys will start working again. Dialysis will help him to live a comparatively longer and an easier life. And also, I would like to tell you that it is not much painful, but yes, it is bit of painful, and there are certain side effects of this treatment like fatigue, low blood pressure, muscle cramps, and all these things. Nurse, then why are you giving this treatment to my father when you are saying that these things are so bad, and then you are saying it's 3 times a week, then you are saying it is a complicated procedure? Why are you giving this treatment? See, I would like to tell you that it is very important to continue this treatment. If your father decides not to continue his dialysis treatment, then he can become very ill, and it can be very lethal as well. So please understand, to save your father's life, this treatment is must. He would have a better prognosis with a better life. But yes, with dialysis you have to be regular, and this is one of the major things that you need to be there for, that your father should be brought every time regularly, 3 times a week. So it is very important. Oh, well, nurse, that's a very complicated decision to be taken. I don't know. Well, I would like to tell you again, if your father decides not to take this treatment, he can become very ill. So please try and understand, it is for the benefit of your father and it is very important to take this treatment. Is it okay? Yes, nurse. Okay. All right. I would like to repeat few things again, which are very important. That dialysis is one of the important procedures when there is kidney failure. If your father wants a longer and an easier life, then he needs to undergo dialysis on regular basis, and that is what's going to make his life easier. So if you would have any further questions about dialysis, you can always ask. This is Bhupesh, and if you have any further problems, there is a leaflet which I am giving you, which contains all the information regarding dialysis. So please go through this leaflet, and if you have any doubt, please let us know. All right, nurse, thank you. So this is how you execute the role play of a nurse, and paper में इतना बड़ा आएगा और इतना आसान होगा आपके लिए करना. Again, you will have to speak for 5 minutes. Patient can be can be cooperative, can be reluctant, it can be anything. So please stay confident and do your task in the best possible way. So this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.
Please like, subscribe, and hit the bell icons for the free OET coaching videos.